Hi, Rebecca. Good afternoon. How you doing today?
I'm great. How are you?
I'm good. I'm good. It's warm out. Hopefully, you'll get to maybe do some late afternoon surfing. I know you got a workout class you gotta get to in a little bit. But I really, first of all, want to say thank you for spending a few minutes with us and telling us your journey through this whole process. But why don't we start at the beginning and just say, you first came to see us because you were thinking about a prophylactic mastectomy. Tell me a little bit about what went into that decision.
So, with my family's history, my mom was the first one in the family to get the prophylactic mastectomy, but her two older sisters both were diagnosed with breast cancer and both had to get a mastectomy after the cancer. And then, even on my dad's side, my grandma had breast cancer. And so, with my personal genetics, I just didn't really want to take a chance and risk having to go through breast cancer. I spent a long time contemplating the best decision for me, and then I just decided
Mhm.
that my odds would be better to get the mastectomy before I ever have cancer in my body, ever have to go through chemo, and make sure that my body's in the healthiest position it could possibly be in before I go into surgery. Because if I were to just, take my chances and let's say, God forbid, I did get breast cancer, then my immune system would be compromised going into surgery that I would have to do inevitably, anyways. So I just thought that this would be like the best option for me.
Yeah, and I love that whole idea of I think it's a very underappreciated point where people can really take control of their own health and have their treatment on their terms. So yeah, it makes a lot of sense, and I think that's great that you were able to do that. So we did surgery last April.
Mhm.
We were able to repair some nerves during your case. What was the surgical experience all like? Was it very painful? Was it weird not having sensation for a while?
Yeah, I think like my personal experience was the best case scenario you could possibly wish for. I know everyone's is different, but I think being someone who was healthy and active and fit and taking care of themselves before going into the surgery probably played a big role in my
Hmm.
surgery and overall experience. I mean, even the day after I had the surgery, the worst feeling I had was just being woken up from the anesthesia. But
Hmm.
like the rest of the day, I was very well taken care of. I wasn't in that much pain. I literally wanted to like walk around by myself, and the nurses were like, no, don't do that. You just need to relax. But the recovery itself was easy. I prepared my mind for the worst and hoped for the best, and that's kind of what I got. Pain wise, I took my pain meds for the day after the surgery and then
Hmm.
following day going home. But then after that, I didn't need anything more than ibuprofen. Um,
Hmm.
and like in terms of like resting pain when my body's just at rest, I really didn't experience that much of it. I think the weirdest part was just not being able to see what was happening underneath the bandages.
Hmm.
I was very curious and like wanting to know what it looked like. But I
Hmm.
feel like I'm really lucky that I had the experience that I had with my recovery.
Yeah, no, you did certainly well. And sensation wasn't there right at the beginning, right? I mean, it took a few months for things to start coming back.
Yeah, as you said, it was very much like asleep. Like,
Hmm.
feel some parts more than others, but really, like, my brain body connection was confused. And
Hmm. Yeah.
like, if I knew I was putting my hand on my breast, I would think my breast was feeling it. But then if I closed my eyes and had like, let's say my mom help me or something, so I could test
Hmm.
experience of sensation, like I would get confused if she was touching my breast or not.
Yeah.
So Definitely, like it took some time to come back, but I do think the sensation exercise you gave me, even though I did not like doing it, it was very helpful.
Yeah, yeah, it is. It is a commitment for sure. But at the end of the day, I mean, cutting to the chase, we are a little over a year. It's a year and about a month following your surgery. What's your sensation like now?
I would say my sensation is back to full. The experience of my breast compared to what it was before is inevitably going to be different because,
Mhm.
like I shared with you in person, the skin feels, but there's no tissue underneath the skin. And so before the surgery, my breast as a whole could feel things, but now it's just the skin that can feel things. But because my mom had a mastectomy several years ago, like she can't feel a thing on her chest. And so I feel really lucky. It feels pretty normal for me right now.
I lost your audio there for a few minutes. Can you still, or a few seconds, can you still hear me?
Yeah.
Yeah. Okay. So, what percentage of your sensation would you say you have back at this point?
I would say like 95% to just play safe, but 100% honestly, like I can feel everything.
Yeah, that's remarkable, and that's such a lovely thing to hear. But it really, what I want to know is what it means to you. Like, what role does that sensation play in your life at this point? Having had it be gone for some time.
I feel like it's something that you could easily take for granted. Um, just being able to feel your body as your body. And then when something goes missing, you're like, okay, that feels really weird. That's a strange experience. So it makes me feel like a whole human with all my parts in place. And then also, like, I will say this as appropriately as possible, but like, as a woman, in a romantic setting, I also appreciate being able to still have access to that feeling as well.
Yeah. Well, that's terrific. Listen, I want to thank you again for sharing your experience with us. I know these things are deeply personal, but I think your story will be very inspirational to a lot of people and hopefully very helpful to a lot of people. So thank you so much for your time. I really appreciate it.
You're welcome. And I think like one thing that I will add,
Mhm.
remember one question that maybe wasn't answered was why I picked you guys. Um, I was actually going to get the procedure done through Kaiser originally. And when I went through the process, I was kind of like mortified by the experience. Like, basically, with them, I wouldn't know who the plastic surgeon was until the week before the surgery, but I had a relationship with the breast surgeon and it was very scary. And then in my process of trying to like figure out where I want to go, two random people had a surgery from you and Ann Peled. And so that really made my search easy. I didn't really have to search. I was like told from for like personal experience that you guys are great and that they loved that their results from you guys. So I feel really lucky that I stumbled upon you guys because I didn't even know that the sensation preservation part of the surgery was an option. And so, with that being an option, it's definitely been like a huge weight lifted off of my shoulders.
Well, thank you again for the kind words, and you've been a great patient and an absolute pleasure to take care of. It's always great to see people doing so well. So again, thank you for your time, and we'll chat again soon.
Sounds good. Thank you so much for everything.
Our pleasure. Bye bye.
Bye bye.
All right, so let me hit the recording stop.